Hi, my name's Hope. I'm from the Positive Health Project. I'm an oncology and lymphedema physiotherapist, and I wanted to take the time today to share with you a case study. This is a patient of mine, a very young woman diagnosed with triple negative breast cancer. And I wanted to share this with you particularly. She's a very special case because I was actually referred um, by her oncologist to see me just as she was diagnosed. So I have been with her through her entire journey from just as she was diagnosed right through until now, which is just after her reconstruction surgery. And so I thought it would be useful to take you through her story and show how my role has impacted her journey and her recovery. She was nice enough to have some input from her perspective as to how she found being involved with myself throughout her treatment. And so you get a little bit of perspective from me, the clinical side of things of what I did with her, and then also from her perspective as how it helped her. So we're going to start off with, so we've got 34-year-old female. She was diagnosed with triple negative breast cancer. As I mentioned, she was referred to me just a few weeks after her diagnosis, so 3 weeks to be exact. So this is sort of the prehabilitation phase. So she hasn't started any treatment yet. So sort of getting her prepared for that stage. She was going through IVF for egg collection, just in case she decided later down the track that she wanted to have another child. She was about to have her portacath inserted. She had seen her oncologist and her surgeon. She was going to commence her chemotherapy in 2 weeks' time. She was physically active prior to having her daughter, but she was not doing any exercise currently. Her daughter was only 1 year old when she was diagnosed. So she was not currently working as she was on maternity leave from having her daughter. And there was no significant other medical history reported. So at this stage, my job was a lot of education, a lot of emotional support as well, and then also getting her started with a home exercise program. So the education was really on the benefits of exercise and how that would help her get through her chemotherapy, that it was important for her to maintain as much as of her fitness and her stamina as possible, as well as her muscle mass, so that she is able to tolerate her treatment as well as possible. So I gave her a home exercise program, and we also planned to meet weekly or fortnightly together to exercise between her chemotherapy sessions, which was fortnightly to start off with, and then was going down to weekly. And then, as I mentioned, there was a lot of emotional support at this point, building a good rapport with her. And we had some good discussions about what was about to happen with her portacath being inserted, with her chemotherapy starting, just going through with her a little bit of the basics as to what to expect. And I was able to answer any questions that she had thought of since seeing her oncologist and her surgeon. So this was her input about seeing me at that point. She said that being referred to an oncology and lymphedema physiotherapist at the time of diagnosis and beginning my appointments with her prior to starting any chemotherapy was essential for both her mental and physical well-being. For her, it was a lot more than just exercise. She felt she had somebody else to hold her hand and give her the heads up on what was to come as she began the fight of her life. So that's from her perspective. All right. So once she started her chemotherapy, which went for about 5 months, I saw her every fortnight, so the alternate weeks between her chemotherapy. To start off with, we were completing aerobic and resistance exercises together. This was at quite a high level. She had some good baseline fitness and strength, and had been previously active, so was familiar with being doing aerobic and resistance exercise. We altered the home exercise program as needed. As she started to get a little bit further through her treatment, we backed off on some of the abdominal and harder resistance exercises, and started to focus a bit more on the aerobic exercises she tolerated. I saw her not long, I think it was like a day or so after she had shaved her head. So really provided some support in that way, because that's a big step and a big change. And obviously we were having our weekly and health mental health check-in with each other as well. So we did reduce her exercise together down to just focusing on the stationary bike and walking. So I think we're doing 10 minutes and 15 minutes of each. When she went down to her weekly chemotherapy, as fatigue was starting to become a bit more of impacting her a little bit more at this stage. She didn't suffer too much from nausea and many other side effects, but the fatigue was sort of the main one. So especially having a young daughter as well, who from memory wasn't sleeping the best at that time. The energy levels were coming down. So we really had to focus on what she could tolerate doing. So then for her home exercise program, we split the resistance exercises to alternate body parts on alternative days. She commenced the next steps exercise class with me, which was once a week, with other women who had been through breast cancer. It was aerobic step class with some yoga, meditation, and resistance exercise. So this encouraged some social connections and to get some support from some of the other participants that were in the group. She was able to manage to stay really quite active throughout her entire treatment. So this really led to her having minimal change in her function. She had no hospitalizations. As I said, her side effects were really quite minimal considering her situation. And then we were also able to have a bit of a discussion about the pros and cons of the bilateral mastectomy that she was considering. And then we also talked through what her other surgical options would be. So it was a little bit of a sounding board for her at that point when she was making some of those decisions about her surgery. So again, this was her input at this stage. She said, through the exercises prescribed that she did in the clinic at home, she had the energy to maintain her quality of life, be available mentally to her husband and young daughter. She was able to keep the positive attitude that she needed to get through her treatment and believe that it would work. It gave her back the confidence in her appearance that is so quickly taken away once the hair on her head, eyebrows, and her lashes started to fall out. All right, so next she had her surgery. So she ended up deciding to go with the bilateral mastectomy, which she needed a left axillary clearance for as well. So I saw her 3 weeks after her operation, and this is sort of what she looked like after her operation. Her LDEX, which is her bioimpedance reading, which is her fluid levels in her arm at a very cellular level, were within a normal range. So I think we got her baseline measure, and so we're just going to continue to monitor now, considering that she's had that left axillary clearance completed. She did have reduced shoulder range of motion. Really, it wasn't that bad, but it still wasn't her full range. And this was at 3 weeks after her surgery. After 2 sessions together, we were able to achieve that full range. So it didn't take her too long to get her full range back. Her scars, I've got some photos that I'll show you next as to the progress of her scars and what they looked like to start off with and what we ended up with. And at that point, she'd been through quite a lot with her chemotherapy and then her surgery. So she was suffering a bit of physical and mental fatigue at that point. So after her surgery, I was seeing her weekly. So we were going through some upper body exercises. So we were stretching out her shoulder and her chest, really trying to loosen everything up around where she had her surgery done. we commenced some work on her scars. So as you can see, quite extensive scars there. We really wanted to optimize the look and the feel of the tissue around the scars. So we started with some scar massage along both the scars by myself. And then, of course, I instructed her to do that as well, which she's always been fantastic with. We started some low-level laser along the scars just to try to break up some of the tissue that was a little bit hard and to bring down the inflammation in the area. Me and myself, we regularly, me with her, we regularly we're moisturizing the scars, and we use silicone tape as well to optimize the scars appearance and the health of the tissue. She was walking quite regularly within what she could tolerate. And we were also having some regular check-ins and talks to monitor her mental health, because it is a big step having both your breasts removed. And so she was going through a bit of an adjustment period there. So initially, she wanted me to do most of the hands-on work, which is quite normal. The sensation and everything is quite unpleasant to start off with around the new chest area, but she was able to take over that eventually once she got a little bit more used to it. So again, her input, she said that we worked on mobility after her surgery, as we said, trying to get her shoulder going again. This kept her accountable for doing her stretches at home, and that we were able, as I said, to restore her range of motion relatively quickly. This allowed her to begin important exercise again and increase her fitness and strength and try to get her energy levels going again. So these are her scars. So we've got how it looked when she first started. And then we progressed through to where her scars were looking really quite fantastic. They were sitting nice and flat. They were really light in color. The tissue around it was really healthy. So we really tried to keep the skin and the scar as healthy as possible while she was covering. And then she started her radiation, which was next. So her radiation started 2 months after her surgery. She did have 16 sessions. Her LDEX reading for her arm was still within the normal range. We were doing, continuing with scar massage, but on her untreated side, we weren't doing much work apart from the low-level laser over where the skin was being radiated. She started to develop some cording and some aching in her arm during the radiation. So I was doing some work to try to assist her with her cording, trying to give them a stretch and reduce some of that tightness. And I was doing some manual lymphatic drainage massage on her arm to try to relieve some of the aching that she was experiencing. As happens during radiation, her skin got a bit pink and then a bit red. So some skin changes happened. So I was just monitoring her skin for any signs of skin breakdown and just encouraging her to continue with the moisturizing of her skin. She reported that there was tightening of her chest and her shoulder muscles, which is very normal during radiation. It tightens everything back up. So we got back into her sort of post-surgery exercises, using the pulley, getting the range of motion going again, a bit of massage as able around the area as well, just to try to keep things as loose as possible for her during that stage. She was experiencing fatigue again, which is quite normal during radiation. So we just adjusted her home exercise program. Again, mostly it was just continuing with some aerobic exercise and some stretches for her chest and her shoulder. So she got through the radiation relatively okay as well. The skin was okay. She managed to maintain her shoulder range of motion. But unfortunately, because there was still some active cells in her lymph nodes, she also required oral chemotherapy, and she started her Zoladex injections as well. So during this phase, she did commence going to the gym. She was doing some walking and some high intensity sessions there as well. She had to finish her chemotherapy cycle a bit early due to some sensation and pain, foot changes due to the chemotherapy. She did have ongoing fatigue, which was improving with exercise. It was at this stage that her LDEX reading jumped up. So it was still within what we would call the normal range, but she did have a 6-point change from the -3 to the +3. And she was experiencing some tension and other symptoms in her arm. So we did commence a 4-week program of wearing her compression sleeve all day to try and bring that down. And we also started focusing on some manual lymphatic drainage during her symptoms. So her LDEX did reduce back down to her normal sort of close to her baseline levels after 4 weeks of compression. So we started to wean her back off of her sleeve. She was regularly attending classes with me during this stage as well. She was doing Pilates reformer classes. She was doing the next steps class. We were doing some circuit classes together as well. So she really did try to focus on being as physically active as she could be during this phase of taking her oral chemotherapy. So as mentioned, she did experience some lymphatic changes at this point. So for her, as she says here, a major concern was post-term double mastectomy and her axillary lymph node clearance was the risk of lymphedema. She said, knowing that she had a resource available to her, whom she was able to see weekly for a massage and monitoring of her symptoms, that this was crucial to her mental health post all treatments and surgeries for her breast cancer. So she's always been a bit concerned about it and has been fantastic with being very on top with my recommendations. And we've been monitoring it very closely when any changes have popped up for her. So currently she's really good. She only wears a sleeve as needed if she starts to feel some changes happen, but nothing too consistent has happened, which is great. Okay, so then she decided to have her reconstruction done. So she had a double DIEP flap reconstruction completed. So I saw her 7 weeks post-op, which was a bit later than what I would have liked, but she did have some wound healing complications on her left breast, which meant that she needed a skin graft from her thigh, and she did have the VAC dressing still on when I saw her for the first time. Because of the complications and the fact that I wasn't able to see her as soon as I would have liked, we did have a lot of tightness around the area in her abdomen and her breasts. She had a bit of a change in her posture as well due to that tightness. She wasn't really able to lie flat. She wasn't walking as upright as she would have liked. So we gave her some advice about stretches and sleeping position for comfort for her to try to get that posture up and out a little bit more. There was quite a bit of tension through the fascia and skin between her breasts, around the breast, and of course along her abdomen and hips. So I was doing a lot of hands-on massage and getting her to stretch quite regularly to try to loosen that all up. So of course, wanting those scars to look as good as possible, did a lot of scar massage and laser. We did a lot of moisturizing and silicone tape to those scars to try to get them looking as good as possible. After a bit, she was able to return to the Pilates reformer classes to try to build her strength back up in her upper body and, of course, her abdomen and hip area as well because of the large abdominal incision that happens with the reconstruction. So yeah, we commenced again her upper limb and upper body strengthening. Once we got the clearance from the surgeon, he was very hesitant, quite hesitant to start off with, to let her do anything. So as soon as we got the all clear, we dived straight in. We were doing regular MLD, manual lymphatic drainage massages during her sessions as well, just to make sure her arm was coping okay. So yeah, our sessions were weekly. We were working really hard on the scars and the fascia. We were monitoring her lymphedema symptoms and really trying to work to make sure that everything was healing as well as it could to be nice and healthy and look as good as possible. And currently at the moment, I think she's probably had it already, but we're there, nearly there. So I'm waiting to see her again after she's had further corrective surgery. They're looking at removing the scarred skin graft site, evening up the breast shape, and smoothing out some things around her abdominal and hip area. So this was the progress of her scars. And so you can sort of see she has the back dressing there on her first photo. I think this photo down here was just immediately after her surgery. This is what her abdomen looked like not too long after the surgery. And then this is sort of what things look like now. So her scars are fantastic. She's done an amazing job with them. The tissue is great. It's feeling really good. So yeah, just tidying things up, evening up her breast shape there. As you can sort of see, her right is bigger than, actually it would be the other way around because it's mirrored. So her left is smaller than her right because the left was, no, her right was the one with the complications. So yeah, so really happy with how it all looks and feels. I think she's going to have a fantastic result in the end, which is great. So just in conclusion, from seeing this patient from the beginning right up until now, so I've seen her quite regularly over the last 2 years. It's been wonderful to be a part of her journey, to get to know her, get to be able to be there for her throughout each step. I think there's many benefits, both physically and mentally, for people to be involved with an oncology and lymphedema physiotherapist right from the beginning. I think we get to build, as I said, quite a strong rapport and relationship with them. So we're just another health professional with a skill set that is really focused on trying to keep them healthy and maintain their health and function throughout their treatment. So they're able to get a little bit of control over the situation, do something that's good for themselves and good for their body during a time when they're going through quite a bit. There is a focus on ensuring the patient is prepared for and able to tolerate their treatment, allowing the patient to really be able to complete the optimal doses of their treatment and try to reduce the severity of any side effects where able. I really like to focus on preventing that significant deconditioning that can happen throughout treatment and that loss of muscle mass, because this really impacts the patient's ability to tolerate their treatment and their ability to recover quickly once their treatment is complete. We're able to do that prospective surveillance for lymphedema. So there's that education and early detection for effective prevention and management of lymphedema, which is quite high up on the list of concerns for a lot of patients. We're able to provide that support network, be a part of that network, both myself as the physiotherapist, but also I've been able to get quite a good group of women together who attend the Pilates classes or come to the next step classes so that they're able to have that support of other women who are going through something similar. I love working with scars, and we're really able to focus on optimizing the skin and scar quality for function, for sensation, for pain, for movement, for the aesthetics of it all. So looking after those scars is quite important to the patient, but also to myself. I think it's really, really underdone sometimes. We're able to identify and do some early management of side effects as they arise. We've got that sort of proactive rather than reactive response there. So rather than waiting for someone to get so bad that they say something and then get referred to me, I'm able to monitor and hopefully prevent it in the first place, or really be early with intervening when symptoms start to arise. We're able to keep the patient accountable and compliant. And those aren't the best words, but they're true with the exercise program. We can make adjustments as suitable for each stage. We can be there to provide that support and motivation and encouragement, that reassurance that this is normal, and how much to push, and know you need to listen to your body and bring it back down. So it really has, I think, helped, especially this current patient, be able to maintain her physical activity and her physical fitness and wellness throughout her entire treatment. So I hope you enjoyed that little case study there. I really wish I could get more patients like her. I really feel like it's benefited her, and it seems like she did too. So if you've got any patients that you feel are similar to her, that have just been diagnosed, that would benefit from an oncology and lymphedema physiotherapist, make sure you refer them. You won't regret it.